Thanks, Mike. Looks like we got a couple questions on Facebook, and I know we talked a little bit about this on Friday, but we can reiterate again, both ORMC and MCH. With some businesses and stuff opening back up, we are both keeping our visitor restrictions, essentially no visitors pretty much unless certain circumstances. Can you explain again why that is the case?
Go ahead, CHRISTIN.
Sure. I could start. We're not in the part of the curve where we're seeing no new cases at all. So we're not in that part of the curve where, as a healthcare system, we should take that risk. Our sense of safety comes from being able to enforce these different precautions that we have to prevent person-to-person risk. And a healthcare facility would be one of the worst places for you to transmit that disease. So at the very least, in our hospital settings, we will keep this going as long as we need to till we feel like there is no significant risk of exposure at the facilities. You don't know who's going to walk in. You don't know what they're going to walk in with, but you do know sick people are going to walk in. So you want to be able to protect staff and other patients. And that's why we have these precautions in place.
CHRISTIN?
So for medical center side, we as a facility have been meeting constantly about our visitation, and we have made the determination to stick with the guidelines that we currently have in order to protect our patients as well as those community members that are coming in. We are going to proceed with opening up visitation alongside the city and what they open, as well as with the cases that we're seeing. I think when you look at the whole community, you can't just look at ODESSA. You have to look at those surrounding counties as well as Midland, just simply because we share so many resources. We share staff, we share places that we eat and shop. So we have to look at both places, and we are not, as Dr. Saraban said, hitting a decline in our cases. And so we want to be mindful of that as well, knowing that as the community opens, we anticipate seeing some more cases just because of people's interactions with each other. So as we change those, we'll make sure to update it. But at this point, we're thinking that probably for the month of May, we're going to stick with the guidelines that we currently have.
Thank you, CHRISTIN, for that. Another popular question on Facebook today, and I know this comes up pretty much everyone, this is for the mayor and for Commissioner Shelton. Game rooms being open, people claim to have seen several game rooms open over this past weekend. Do you guys have any updates on that or rules, etc.?
According to the governor's executive order, game rooms are not to be open. I've had police officers check. They have not found any open in the city. I'm not sure. I'll let Eddie speak about the county.
Well, I had talked to the sheriff, and he had said that the county attorney had said that they were allowed to be open. So that's where we're standing right now. So they saw some open, and that's the reason why they were probably in the county.
Thank you for that. And one more question here for the doctors or even the nurses as well. I know we're seeing a rise of more than 1,000 cases a day in the state of Texas. Are we, as far as we can educated guess, at our peak here in Texas, or can we expect a peak maybe a little further out now that businesses have slowly opened back up?
Hard question to answer for now, Trevor, but this is the risk that we run with some reopening. We knew that that's the risk we would run with some reopening. Let's wait a week, maybe 2 weeks, and then let's ask that question again. And I think we'd have a better idea of, is this a second peak that we should expect, or is it not? You know, with the reopening, the social distancing principles still have to be followed. But if they are not, and people think it is a free-for-all, then you do run that risk of, hitting a second peak, going up from where you were, even though you were maybe starting to stabilize a little bit. So time will tell. I'm hoping that's not the case, but time will tell. Let's wait a week and two and ask that question again.
And Commissioner Shelton, just to reiterate, the 6 new cases in the county, or I don't even know if Dr. Benton is still there, they are obviously doing contact tracing on these 6 new cases, correct?
Yes, they are. And Dr. Benton would have that information on those if he were here, but they are doing contact tracing on them. The sheriff did send me a notice that there were 2 violations against game rooms after the governor's first order. And the citation was a violation of the governor's order.
Thank you for that update, Commissioner. And before we go, I guess we'll just send it back over to Russell, something from the good word.
Absolutely. Today came across to me is Proverbs 3:5. Trust in the Lord with all your heart. Lean not on your own understanding.
All right. Well, thank you for everybody for joining us. We'll be back tomorrow at 3 o'clock.
Thank you.
Thank you.
Thanks, guys.
Thank you.